Yeah, we've had an absolutely fantastic conference, one of the best conferences ever, I think, for the BGCS. Wonderful venue, fantastic weather, quite warm, but in the conference venue, but it's been really, really good. Everything about the process of the conference has gone beautifully. The catering's been great, the organisation's been fantastic. So we're really indebted to Tim and to ISO for the work they've done in getting it organised. It's been brilliant. The scientific content has been great as well. We've really been working as a society to try and be more inclusive to the non-surgical oncologists who work in the gynae-oncology field, trying to involve the nurses, the scientists. And so the society has often been perceived as having a very strong surgical influence, which it still does have, but we're cognizant that we want to make a society that's much more inclusive, and the content of this meeting reflects that. There's been some really excellent presentations on surgical issues like sentinel lymph node, for example, which is a really important issue for us at the moment, and that we're developing as a clinical community. But also some fantastic presentations on developments in medical oncology and clinical oncology radiotherapy for gynecological cancers. I attended a really excellent session this morning of the NFGON, the Nurse Forum group, which is now becoming part of the British Gynae Cancer Society, and they had a fantastic program talking about some of the quality of life issues for patients who've undergone vulval cancer surgery and sexuality after gynae cancer treatment and that sort of thing. It was an excellent session. And we've also had some wonderful presentations from our trainees and, and researchers who come along and present their abstracts, and had some excellent poster presentations and oral presentations as well. So it's been a really successful conference. We have got some conferences coming up. We have a conference on the 30th of November in Canterbury, which I'm particularly passionate about. This is a one-day conference in the Cathedral Conference Centre in Canterbury, which is a lovely venue. And that's an opportunity for the charities who work in the gynae-oncology field to showcase their wares. They have a session each to be able to present some of the projects that they've been working on over the past 12 to 18 months. And we've also focusing on quality of life and survivorship after gynae cancer treatment. So we've got Dr. Eva Greimel, who is a psychologist who works in Graz in Austria, who I've been working with in the EORTC Quality of Life group for many years. And Eva's coming over to talk about quality of life and survivorship assessment particularly assessment of quality of life after treatment. And we've got some presentations on problems following radiotherapy and sexuality. So that's an exciting meeting. Immediately before that, on the day before, we're meeting up as a group of clinicians to develop a consensus statement on the use of sentinel lymph nodes in gynecological cancer surgery. So that's exciting as well, looking at reducing the morbidity, reducing the complications and long-term effects of our surgery, where we can do that safely. And then next summer, we've got our annual scientific meetings in Cambridge next July, so it's a fantastic venue. Robin Crawford in Cambridge is leading on the scientific organising committee, and we'll have a program, the same type of thing as this, which is again going to be specifically look to be inclusive to all of the disciplines who work in our field, not just it's focusing on the surgical aspects, but focusing on diagnostics, and have a session for the diagnostic gynecologists, the unit leads who are involved in diagnosing the cancers. We have sessions for a session for the nurse forum group. We'll have a separate breakout session, and we'll also have all of the sessions looking at medical oncology developments, feeding back from the ASGO meeting. So it'll be a similar sort of format to this one, and it'll, again, in an absolutely wonderful setting.